Dr. Osahon Enabulele was born into the family of Elder Jonathan Igbineweka Enabulele JP and Evangelist Mrs. Rachel Enabulele of Uselu Ega local government area of Edo State. He is a chief consultant, family physician, immediate past president of the World Medical Association, a strategic thinker, visionary, public affairs analyst, health activist, civil and human rights activist, and a renowned leader popularly known as the Lion Killer. He is the only Nigerian physician to date with the unique distinction of having risen through all the various stages of medical professional leadership, right from his days at the university to the national level as president of the Nigerian Medical Association. He is thus the very first Nigerian and the very first West African physician to ever be elected president of the World Medical Association WMA since the World Medical Association was founded in 1947. He is happily married to his lovely wife, Professor Mrs. Joanne Enabulele, professor and consultant restorative dentist, and they are both blessed with 3 lovely children. Ladies and gentlemen, with a clapping ovation, let's make welcome for the first time at the International School of Ministry and Leadership Conference, Switch 2024, Dr. Osahon Enabulele.
Compulsory routine medical checks every leader must undergo for longevity. And I'm sure a lot of things are already going through your minds. And before I move to the next slide, is there anyone here who has not heard about routine medical checks? Or who has heard of routine medical checks before? Just raise up your hand wherever you are. Anyone? I look this way, I look that way, I look this way, and I look this way. Everybody's hand is down. So that means no one here has heard about routine medical checks. Is that correct? Never mind. I should ask the question again. This is not a jam question anyway. It's just an attempt to see how people will respond to what I'm going to present. Has anyone here ever heard of the term routine medical checkup? Aha. So that means your spirit was somewhere else before. All right, fine. I'm happy. But a survey form will soon go out for you to fill. You know we are researchers, so anywhere I go, I research. But I already have an idea of what everybody here has to say with respect to routine medical checks. So I've been introduced, and I'm happy to be in the city of David. Thank you, Pastor Charles Osazoa. The blessing is already flowing. Next slide, please. Next slide. Yeah, so learning objectives. I hope through this presentation to be able to introduce you to the concepts of routine medical check, to also get you to appreciate the benefits, and if you like, some of the challenges of undertaking routine medical checks, and hopefully get you inspired to commit yourself to undergoing routine medical checks. Because a lot of persons have different opinions and different perspectives about what routine medical checks is all about. And of course, give you a brief introduction into the framework and the scope of routine medical checks. I'm happy to do this in the next couple of minutes. Next slide, please. So these are going to be my learning objectives. And I hope I'll be able to, of course, inspire you along this line. So this is my outline. We'll look at some definitions, trying to look at a conceptual framework again, a bit for the background, and then look at some of the benefits and challenges, and of course, the framework for routine medical checks, and then some recommendations I may have to. I'm immediate past president of the World Medical Association, and so everywhere I go, I make recommendations. So maybe beyond the scope of this presentation, if I have the time to do that. Now, next slide, please. So, when you say compulsory, you all know what compulsory is, because this is what I was asked to talk about. Compulsory routine medical checks for every leader. And when you say compulsory, it means obligatory, mandatory, prescribed by law. That is a rule or something that has been authorized to be done by those who populate an organization, institution, state, or country. But I would not like to dwell into this, otherwise to detract us from what I'm here to present, because there are schools of thought about whether medical checks should be compulsory, obligatory, or not. But let's not get distracted. I just thought you should understand what this means, especially in crafting this topic and sending to me. Next slide, please. Now, when we say leader, who is a leader? I teach leadership. But unfortunately, a lot of persons who are even leaders, who call themselves leaders, do not understand what leadership is all about. I'm sorry to say. And this is from my experience. It has nothing to do whether you're a governor, president, or local government councillor, because those opportunities are gotten through certain mechanisms which will not be pure. But when we talk about a leader is one who inspires, who has a vision, a visionary, inspires votaries of change and reformation, transformation, to key into his vision, is able to collaborate with others, organize towards achieving a collective objective, if you like, institutional, organizational, and in this case, the church's objective. And there are several attributes of a leader, and I'd like to talk about transformational leaders and not transactional leaders. All right? And so, these are the kind of people I was asked to come and talk to. Transformational leaders, so that they can also transform their followers to undertake routine medical checks. There are several issues when it comes to leadership, but I'd like to save us that now so that we don't dwell into the Nigerian states and, of course, the African dilemma. So that is what leadership is all about. I was a leader of all doctors in the world. I used to be #1 doctor in the whole world as at October 2023. And I was leading people from all over the world, and so that is leadership. Next slide, please. And these are our leaders from all over the world. And of course, you can see there are very few black people there, but I'm happy to be from Africa, to be from Nigeria, and to be from Edo State and Uselu, local government. Next slide, please. So this is leadership. Now, longevity. You're asking yourself now, will this talk make you live longer? Will it make you have a longer lifespan? Because longevity is all about living longer, increasing the duration of your livelihood, your life. So you can see these are examples. There are regions of this world where people live to that level you would love to live. But of course, we come from Africa, which unfortunately has the lowest life expectancy in the whole world. And that is very unfortunate for me. I mean, when I was in Tokyo, Japan, the man who was taking me around was 85 years old. I mean, and he was still like a baby. Japan today has the highest life expectancy in the whole world, if you understand what I'm saying. So this is what longevity is all about. So the question is, can routine medical checks bring about longevity? Because that is part of what I was asked to talk about. Those fundamental thematic issues I hope to address before I conclude this talk. And I hope Pastor Charles Osazoa will allow me to do that within the time allotted. Next slide, please. So these are examples of, unfortunately, as we always have in Africa, we don't document our stories. And that is why when I was president, I kept challenging the world that everything did not start from the West or from the global North. We had history in Africa. When I was in Uganda the other day, I wanted to look at the source of the Nile. They told me that it was one European that discovered the source of the Nile. I said, were people not living there before? There were Africans living there. They say Mungo Park discovered River Niger, when Nigerians not living there before. But we don't document. And so even in the documentation of those who have lived long lives, you'll find them all white. Where are the Africans? And that's why I put a picture of this lovely elderly African there. That we also have people who have lived long lives in Africa because of our habitats and the way we live our lives that have always been very inspiring to the rest of the world. But that is not a talk for today. Next slide, please. Now, next slide. Now, just to set the scene, routine medical checks is not a new concept. And that's why I try to sample the opinion of all of you at the very beginning. It's always been there, right from time immemorial. So it's not new. But what is new is the fact that there are events in the world that have transformed even the process and the operation and methodology of conducting routine medical checks. Even in the scriptures, everybody wants to be in the best of form. You need to check your spirit, your body, your mind, to make sure you are in good state of awareness. So it's not new, and it's known to have benefits, all over the world. But the question, again, that has inspired a lot of people to say they want to undertake medical checks is because of this critical issue of longevity. It's one of the questions I'm going to address later on, whether it leads to longevity or not. But I want to dampen your spirits now. So like I said, it's also scriptural. I mean, you can relate it. I'm happy the last speaker mentioned that he had doctors in his church, and that means he believes that this is something that they must undertake. Now, remember Aristotle. Aristotle once told us that an unexamined life is not worth living. So even your health, if you don't examine it, then of course, you sooner or later come to your peril. We all have to do that to make sure that we have stable minds, stable health, physically, mentally, intellectually, emotionally, socially, and even environmentally. Now, some therefore only go for these checks when they have a problem. They forget that when they have their cars bad, they take their cars to the mechanic. When your roof is leaking, you look for somebody to fix it up. But when you, a living being, has a problem, some just endure it until it gets so bad before they even come to the hospital. And they start complaining that the doctor is not there, the doctor is not seeing them, he wants to die and all of that. But the death started right from somewhere. And that's what we talk about social determinants of health most of the time. That is not all that happens in the hospital that leads to the mortalities that we see. And that is a fact. And we have driven this all over the world. A lot more happens outside the hospital scene. Now, so like I said, the whole period of the Industrial Revolution buoyed this whole concept of routine medical checks because a lot of the capitalists needed their workers to remain healthy. And one way was to ensure that they undertook medical tests. But that was to ensure that their profiteering propensities were maintained. So that was not really the basis that we all expected should be the kernel for having. So that was more of a capitalist intention. But again, technology has also buoyed this. You now have a lot of technological gadgets that even those who may not want to go to a health facility can use within the confines of their homes. But routine medical checks is much more than that. But again, what has also given it a boost in recent times has to do with the challenges we are facing globally. I was in the Vatican City the other day in Rome, and we had a good time with the Pope Francis to give a talk on the African experiences on some of these issues. And I let them know that the world is facing lots of global challenges. And it's not only Nigeria, it's all over the world. Now, these challenges are even worse now after the COVID-19 experience. So the fact that we have rising global disease burden all over the world with increased mortalities all over the world suggests that we all have to start checking ourselves. As I speak to you now, Africa is worse off. So even we in Africa is more incumbent on us to undertake routine medical checks, which those in the industrialized countries take for granted because they have insurance schemes, for instance, that cover them from time to time. But how many people are on insurance in Nigeria, in Africa? So you have to take up that individual responsibility if you must remain healthy. So next slide, please. So this is just what I would call prefatory remarks. So these are the issues. We have widening health disparities. I talk about this all over the world, that for as long as the disparities remain, we'll continue to have challenges in global health. People do not have access to care. In Nigeria, the access to care is very poor. In Africa, it's the same thing. So we must encourage that bridging of the gap. And one way is to ensure that we have the institutional frameworks to encourage people to go for medical checks. Next slide. So you can see why we have access gap. Professionals are not there. Of course, we have Japan syndrome now, but this is not what I'm going to talk about today. I talk about that. I've been talking about that for over 30 years. Next slide, please. So you can see we have in Africa a doctor population ratio that is the worst all over the world, and so people do not even have access to care. So even if you want to go for routine medical checks, where do you go to? You're even better now in the cities, but what in the rural communities? I always say there's no poor medicine for the poor man. The quality should be quality everywhere. Next slide, please. Now, this has affected a lot, in terms of service coverage. Move on. So it's not there. So we have more problems in Africa. And of course, the UHC, what we call universal health coverage, is also very poor in Africa. So whereas the most parts of the other developed communities or world are trying to ensure that everybody is covered by insurance and make sure that their health is in good state, we don't have that in Africa. Nigeria is also not there. Well, that is not my talk today. Next slide, please. Next slide. So this is just to tell you that Africa, so you can see the life expectancy. The World Health Organization has projected figures to, as you know, further down to 2048. So even as 2028 is projected, where all regions will be in terms of life expectancy. So when we talk about longevity, you can already see where we stand in Africa. Africa currently is the worst. Even at 2024, it's projected that we'll still be at 67.0. Look at the rest of the world. So we have issues. And one way is to really focus on this routine medical check. So what I'm doing is to give you a basis. Are you there? Are you there? If you're not there, let me know. I can bring you back up. Next slide, please. So there are various types of medical examination, really. So routine medical examination is just one of those examinations that are undertaken. It could be purpose-driven. For instance, when you want to start, they admit you into a university or in secondary school, they ask you to go and do some checks. So that's a form of medical examination, but it doesn't fit into what we call a routine medical examination. So there are various forms. I'm not going to dwell on that, but also let you know. So you have various, if you want to get employment, sometimes they ask you to do medical check. It's a form of medical assessment, but it doesn't fit the bill totally of what we call routine medical examination. Next slide, please. So what is routine medical check? Now you can see on the right, that was me checking the then Speaker of the House of Representatives, right, Aminu Tamboa, who is now back in Senate. And I did that for a reason, I'll tell you later, so that I don't get deviated. So what is a routine medical check? They call it by different names. Some say wellness clinic, general medical examination, physicals. Some will tell you they are going to France for their physicals. So one of the reasons I did it for Tambo was to tell him that you don't need to go to France. You can do it in Benin. You can do it in Abuja. I can do it for you. Physicals. They say I'm going to France. Status symbol for my physicals. And I see them all in India, meeting people who are less qualified than us. I see it all the time. So it's a comprehensive medical assessment of an apparently healthy individual. So it's not for those who are sick, really, to say they are going for a routine medical check. It's actually for apparently healthy, because you want to remain in that state of health, that state of wellness. That's good well-being. If you are sick, you go for a sick visit for acute medical care, either in the primary care clinics or anywhere. So it's different from that. So, and it is aimed at assessing the totality of your health status from head to toe. You want to be sure that you are still fit, that you can still undertake the assignment that Pastor Charles Osazuwa will give you tomorrow. That is the essence. And so it involves a visit to your physician, what we call the primary care physician, really, or the family physician who has actually also gone higher. I'm a consultant, chief consultant family physician, so that's my area, that's my domain. I'm sure they didn't also know that, but I'm also a chief family physician. So that's what we do all the time. So it involves using different test modalities comprehensively to assess you, to get to make that conclusion as to the state of well-being of that individual, who actually came in believing that he was healthy. But of course, after the assessment, we will not tell you whether you're actually healthy or there are risk factors that we have detected that we need to quickly manage to prevent the development of a condition that you may not really like. So that is the ultimate aim of doing a routine medical check. So it's for everybody. It's for everybody. Don't say it's not my portion. It's our portion. So, move on to the next slide. Please, if I'm halfway through, or just let me know, because I don't have any timer here. But normally we have to have timers here. I have time? Where's the timer? Where is it? Well, I don't have spiritual eyes here. Oh, okay, thank you. Now, I've seen it. One should have been here too. Well, I'm right-sided. All right. Now, so a good periodic health examination is of what we call asymptomatic people who don't really have symptoms, who just want to go and check, like I said before. And of course, is to ensure that we prevent disease conditions from happening. Or even when we now see that there's a disease, to prevent a worse outcome. Oh, looks like this guy has a blood pressure. He never knew, because blood pressure has no symptom. And we discover it, because blood pressure, for instance, is a risk factor for developing what we call cardiovascular events, heart attack, what we call myocardial infarction, CVA, stroke. Oh, they say just there for a room, just finish watch match. Now, so it go. All sorts of thoughts come in. Looks like his own people have followed him there. It's not his own people. He has not been checking himself. The blood pressure rose. Immediately, Nigeria scored the first goal. Nigeria. That's what happened. That's the reality. So the approach may vary from physician to physician. The way I'll do it may be different but there are standard guidelines. Next slide. Now, it is therefore centered on prevention, essentially. Preventing a disease from occurring, or where the risk factors have occurred, preventing it from going further. So we talk about different levels of prevention. But this is not the class for that. But I just said, briefly, it's actually aimed at preventing worse outcomes. There are different levels of prevention. We have primordial prevention. That has to do more with environmental, social, cultural issues, addressing them, which is what the Nigerian state largely is not doing. What we call the social determinants of health, like I told you earlier. State of your environment, education, health, roads, your poverty status. A man has not eaten for how many years? How will it look like? Not be healthy. So it's not about, so those are the conditions that if you can structure, which the developed economies are doing, that is making them have this higher lifespan and all of that, life expectancy. Those basic existential objective conditions of living, which we are still struggling with in Nigeria and most of Africa, is what is causing the difference. Commitment to the health status of the people. So you have primary prevention, for instance, vaccines. I'm sorry, because this is something that we had to address during the COVID era. You know what I mean. But it's the reality of life that vaccines are meant to prevent disease conditions. Australia, for instance, today has one of the best outcomes or reductions in incidence of cervical cancer. Why? Because they discovered early that the moment they started giving vaccines to their female, there were children, the female sex, subset of the population, the whole thing just went down. And they are now used as an example globally. So it has its advantages. When we were born, the first few vaccines we were given has made us to live healthily. Polio, BCG, and all of them. They prevent you from coming down with those things. So they have their own values. But secondary is when you have detected it, you want to prevent complications from actually occurring. A man comes to your clinic, you find out that his blood pressure has been very high. You even determine that, this guy is hypertensive. So it helps you to quickly start treating him and preventing what would have become a worse outcome. Because blood pressure can affect the brain, can affect the eyes, can affect virtually all organs, the kidney, the heart, and all of that. And cause kidney failure, everything. Multimorbidity. And of course, tertiary, when of course it's gone too high, then you have to start rehabilitating. But this is not my talk for today. Now, next slide, please. So there are individual choices that need to be made. And that comes to the issue of whether it's compulsory. Globally, there's no agreement on this because of the evidence before us. I don't want to throw the evidence at you now so that you don't get distracted from the presentation. So based on global research, nobody is forced to do it, but we only educate you on the benefits. So you take a choice, you take a decision. And my decision is to regularly go for checks. I go for my checks every year. On my birthday, I do my checks. So you have to take a choice because health is part of your social responsibility, your own personal responsibility, as much as government has a responsibility to the health of the people. So, but there are at-risk people that we always encourage to go. For instance, those in disadvantaged communities, vulnerable populations, children, women, pregnant women, elderly, and all of them. Or those who already have feelings of having, this perception that they have some challenge that they think they need to go, of course, for assessment. And, of course, so many other things are there, but I'll move to the next slide now quickly. Next slide. So there are different benefits of doing a routine medical check. Several benefits. Several benefits. And one is that it helps you to detect a problem early on that if left unattended to would have resulted in something else. Early diagnosis and prompt intervention. That is one fundamental. If that is the only benefit, it's a very good benefit. The second is that it allows you to identify risk factors. The guy comes, he didn't even know that he had high cholesterol. You've heard of cholesterol before. It's a problem. He never knew. You do a lipid profile for him. Cholesterol is high. You have to manage. Otherwise, if you don't manage, it's also a precursor for CVD events, cardiovascular events. The same thing with the blood pressure. The same thing with the sugar. He never knew. To be modest, without being modest, I was the first president of the Nigerian Medical Association in 2012 because of my obligation to society, because of what I saw as a gross health gap, access gap in Nigeria, which the government was not willing to fix. I said, look, we can't keep calling on government. And I told my executive and convinced my members that we needed to do what I call corporate social responsibility. And we introduced, on 1st of September, the first medical mission to be organized by the Nigerian Medical Association. That mission has been running since 2012 till now, and we have seen over 200,000 people thus far from all regions of Nigeria. The point I'm making here is that, but for that mission, there was a professor who never knew that his sugar level had hit over 400 milligrams per DA. And he was still with us. And I had to tell him, Prof, we'll give you emergency management now. You need to go home for management. And he's ever grateful today. He's in the United States right now. That's the essence of routine medical checks. I told the then speaker, I said, your people are suffering. You are Speaker of House of Representatives, but I go to your community, Tambowa community. It's nothing to write to me about. We have to start working to have outreach in that place for medical checks. And what we discovered was staggering. And I made him the face of healthy living in Nigeria. And I gave him a plaque to carry all over the place, that you now need to promote it beyond your own family members. So it has its own benefits. It improves your lifestyle. A lot of people do not know that diet, sleep, your social behaviors, alcohol, smoking, and all of that are problems. It is from that visit, when they educate you, that you begin to understand the implications. So it gives you opportunity to improve your lifestyle. Some people think that it is good if they don't sleep an average number of hours a day. They are hardworking. You are killing yourself. Because deprivation of sleep is also a known precursor to development of certain cancers. You don't exercise. Or walk. I exercise, I've been like this since 30 years ago. Don't think I was born yesterday. I exercise. They say, now this boy be world president. Come and meet me, I'll tell you how I do it. Now, so it gives you improved self-satisfaction. Oh, doctor has checked me. Oh, he has said I'm well. It gives you a new reality, a sense of well-being, to undertake even more arduous assignments. That's why some people go to France, go to Spain, say, I've done my checkup. Oiboma don't see me. He said, I'm fine. But you can be declared fit in Nigeria. What I'm saying is that it gives you a sense of renewed being. And, of course, lowers your medical costs. Because if you waited and that thing was not discovered, and what betide you, it was later developed into cancer. You know the cancer burden in Africa? It costs for attending to cancers, and even any chronic disease condition. Diabetes, for instance, is a chronic disease condition. Hypertension is a chronic disease condition. In my clinics that I run, I still run my clinics. I see patients unable to even procure the minimum drugs you prescribe. And we have to bend over backwards to support them. Imagine you have multiple dimensions of those disease conditions, what we call multimorbidity, different conditions at the same time. They discovered hypertension, they discovered diabetes, they discovered the other one. How will you cope in today's Nigeria, where inflation has hit the roof? So it helps you to also lower your cumulative costs that you would have incurred. Are we still there? Thank you. Next slide. Now, I'll go into the main meat now. What do we really do when you come for a routine medical test? All right? I have to move faster now. You have history taken. We take your history. How have you been? What is your family history? Do you have a family relative that had cancer before, that has diabetes, that has hypertension? Because some of these things runs in families. We do a lot under history taking. Then we'll examine you. Just examining you alone can discover a lot from head to toe. Just by palpating your chest, we can determine whether your heart is enlarged or not. Just by looking at the colors of your eyes. So several things can be undertaken, but it's not compulsory to do a physical exam. It depends on what the doctor has seen. All right? And of course, you take measurements, your weight, your height, and we'll discover your body mass index, which gives an indication of whether you are obese or not. Because obesity is a problem. Some people see it as a sense of arrival or being rich. You are killing yourself. I'm sorry. It's not, because the implications are well known. And of course, you can do some laboratory tests. Your complete blood profile can be the first signal to know whether you have a problem like leukemia or not, or whether your blood level is low. Your urinalysis can give you an indication whether you have sugar in your urine, whether you are even diabetic, or whether you have even a problem with your kidney. It can give you that pointer, that indication. And of course, your liver enzymes. Then, of course, your hepatitis screening. We know these are problems, and so many other things. Now, if it's warranted, your doctor can ask you to go for a chest X-ray. It's not compulsory, or ECG, or what we call echo, that goes deep down to look at the internal workings of your heart. Can ask you to do that, but it's not compulsory. And of course, mandatorily, we want to do cancer screening. For men, mandatorily, we want to do a prostate cancer screening, because prostate cancer is one of the killers of men today in Africa, including Nigeria. In fact, prostate cancer, the incidence is worse more in Africa. So mandatorily, especially when you have a relative or a parent that has had prostate cancer for the men. So we do that, what we call a PSA, to look at it. If there's an indication, we can say we'll have to go further. So PSA mandatorily for men has to be done. Then, of course, we also do colon cancer. If there's nothing you have learned today, is to say that, please, once you've reached the age, go for screening for colon cancer, because it's a deadly killer. I just finished doing my own. One of our presidents of the World Medical Association, we lost the president because of colon cancer. He never knew until we got to a conference one day and we said, who has done colon cancer screening? If you have not done, the surgeon who was there said he was ready to do it for anybody. And she went and did it. And lo and behold, that was it. From one chemotherapy to the other, eventually we lost our president. So that is to say, it is something you must put in your reckoning. Because if you don't detect it on time, there's no amount of work you are going to do. I just lost a classmate from colon cancer. So it is part of the screening. And once you do it and it's okay, you wait for the next 10 years. But of course, before you do your colonic, colonoscopy, what we call colonoscopy, there are other lesser tests you can do to give you an indication. But I have had people just go straight and do your colonoscopy. Because if it's okay, you wait for another 10 years, Now, breast cancer also, cervical cancer, those screenings can also be done through a routine medical check. And of course, it provides an opportunity for you to receive immunizations, what we call vaccines, if you have not received before. These days, hepatitis B, you want to receive vaccine for it. You want to be immunized against it. But it's not good in the body. For the ladies, the HPV vaccine, to prevent cervical cancer, for instance. Then, of course, there are others. These days for elderly, and of course, older adults, we ask them pneumococcal conjugate vaccines. to prevent pneumonia in later life. It's still on. It's an emerging thing. Then, of course, for elderly ones, we can assess them for their fall risks. You know, they fall because of their posture and all of that, their gait and all of that. So we want to do assessments for their hearing, memory loss, and all of that. Then you use that opportunity to also counsel you on your lifestyle practices. How do you eat? When you're asking people, how many times a day did they say, "Oga, I not get money"? It's not about "Oga, I not get money." Because money is not everything. Your diet, we have natural ingredients that you can formulate. Our ancestors did all of that. So we can bring you back to that and say, money no day. Go grow one garden. You know, and I put things together. Have balanced diet. Otherwise, if you don't have it, it's a precursor to ill health and other devastations. Exercise. How do you exercise? We ask people to exercise at least minimum of 3 times a week. 3 days a week. 3 times, or 4 times in a week. At least 15, 20, depending on your reserve. 30 minutes at once. Once you start sweating, you know that you are exercising. If you have not sweated, then forget it. There are various forms of exercise. Well, that's a different class for that. And of course, stress management. Importantly, using that opportunity of a first check to advise you if you are an alcoholic to stop alcohol, to stop smoking, because they are deleterious to the body. But alcohol these days, I'm sorry, I'm in a church. The evidence, and that's what we preach. We're not fixated on total stoppage. We say, okay, cut it down a bit. What we call moderate consumption, because of the evidence, scientifically. But like I said, I'm in a church. So, we advise, if you can stop eventually, that's your individual choice. But smoking, please stop smoking. But people cannot stop smoking at once. We graduate it and using some methodologies. Next slide, please. I have virtually talked about all these things because I'm watching my time. It's almost off. But I hope Pastor will give me some more time. Move on, next slide. So basically for men, like I said, we check your blood pressure, and there are intervals for doing it. If it's okay the first time, we say come every year to check your blood pressure. You are surprised? Blood pressure is not what you do every day. Or if you want to do it, it's your individual choice. But evidence-based, we say, okay, based on the guidelines, come every year. But if you have this figure at all, I don't mind if you check it every time, especially if you indulge in stressful events. Or if you watch Arsenal and Chelsea every day and you are shouting every day. Or Man U, or Better Insurance, anyone. So, obesity, we check for obesity because it's a killer. We use a BMI most of the time. If you have a BMI, for instance, of less than 18.5, we say you're underweight. If you have it between 18.5 and 25, for instance, or 24.9, we say you're okay. I have had a BMI, normal BMI for over 30 years. I'm happy about myself. What about you? Have you checked your BMI? So if it's more than that, we say you're overweight. Then if it's more than 30, we say you're obese. And there are various gradations of obesity until you get to what we call the morbid obesity. It's a killer, whether I like it or not. It has several complications, but that is not the talk for today. So we also check for, abdominal aortic aneurysm. A vessel just there, pulsating, you're seeing it yourself. Can do an ultrasound for you and see whether it's a problem and quickly intervene surgically. That may be the first time you are even knowing that it's a problem. Because if you do not do it, the next thing you see is a rupture. And that can cause your death. Next slide. May it not be our portion in Jesus' name. So we also screen for diabetes and all those other things. Do your lipid profile, like I said before, cholesterol. Move on. I need to round up now, please. Move on. Except I have the privilege of Pastor Charles Osahon. I just came into town. Okay, no, before then, I've talked about colorectal screening, cancer, for those aged 50 to 75 years. So you either do the fecal or cord blood, they say go and pass through somewhere and we assess. But that one has its own problem. So I usually, advise people to go on the third one, colonoscopy. Meet your doctor, your GP, for instance, your family physician, and say, I want to do a colonoscopy. But once you do it first time, next time you do it is 10 years. Because of the evidence of how we know it evolves. Then, for those who have a family history of colon cancer, you do it at a much younger age. And then, you also screen for lung cancer. Move on. So if you have been smoking for the past 30 years, taking at least a pack a day for the past 30 years. You say, look, you better go and check for lung cancer. Don't say they visited you last night. Go and check. Because the evidence suggests that it's a primate of bronchogenic carcinoma, cancer of the lungs and the bronchioles. Next slide. So for women, almost the same thing you do for men, except for some differences in terms of the categories of cancers we screen for. So move on quickly so that I can round up. So all of this I've spoken about. Move on. Move on. Yeah, so we screen for breast cancer. I hope the women are here. Please take this very seriously, because what we see in Africa and Nigeria are late presentations at a point when you are no longer able to do anything. Breast cancer is curable if detected on time. Are you hearing me? Just the way prostate cancer can be cured if detected on time. There are modalities for it. You are supposed to do your breast self-examination monthly. So you are in your bedroom, rubbing cream and your soap and everything. Please check your breast. You may just be able to see something. May you not see anything in Jesus' name. Abi, it's not our portion, but whose portion is it? So you have to check. You have to check regularly, monthly. And then when you visit the clinic, no, this thing is real. We've lost even colleagues, doctors from this. And you'll be asking, I'll not be a doctor. Maybe he was not checking regularly. Now, but when you go to the clinic, we will not have what is called clinical breast examination. The doctor now does his own to check properly. He first of all asks you, have you noticed any lump while you were examining yourself? Oh, I've not been examining. Okay, I will examine. Clinical breast examination. And we do that at the first visit. And of course, we say begin at the age of 20 years. All right? And then for those who are between 40 to 49 years, we say do a mammogram. It's like an imaging technique. All right? Put a breast on, and then the x-rays will be taken to see whether that lump or that swelling is of any significance. That may just be the beginning of eliminating that problem. So we ask them to go for mammography every 1 to 2 years. All right? And then for those who have other risk factors, maybe had a brother or a sister who had a breast cancer, we say do it much earlier, at an earlier age. Cervical cancer is real. And for the young people here, young females here, please, I ensure that my daughter had HPV vaccine in her secondary school. So I'm at rest. You do a pap test, pap smear test, very simple to do, to check whether there's any abnormality, and you start that at the age of 21. All right? And we ask that you do it, if you are between 21 to 29 years, you do it every 1 to 2 years. If there's no problem, you now do it every 3 years. And then, of course, if you are 65, 70, you can stop. But you must go for a pap smear test, because that's the commonest one we do here in Nigeria and Africa. I know you are bringing paper. All right, so I'll round up now. So please do that, because we need to save our young girls from cervical cancer. This scourge is overwhelming. We are losing our women because of this kind of condition. And the World Health Organization and the World Medical Association has made it a matter of commitment. So we must commit ourselves to it in Nigeria. If nothing comes out of here, please, you must go for cervical cancer screening. Next slide, let me just round up. So there are issues. Move on. I want to round up now, because I don't want to tempt the spirit here. Now, so we do also counseling on all issues when you come for the health check. Move on. There are a lot of issues. But there are challenges. Move on. The challenges are many. We don't have facilities. The infrastructure is wrong. Our belief system. Some people believe that it is not their portion to go for routine check. You are very spiritual. But your car is not spiritual. Your house is not spiritual. You must do a health check. So that social, cultural, and religious belief system has to be deconstructed. And the deconstruction starts from today. This slide is telling me to go too. Now, there's also the poor awareness of the concept. A lot of people do not know. You are even fairly well aware. Go to the rural communities where we have over 60-70% of our people living. What do you bring on? You say, may I go do check? Who born you? No, I know they do. My parents is not the one. Poor awareness. And the government is not committed to it. Because they do not believe in your health and well-being. For as long as they continue to weaponize poverty and block access to social obligatory activities like health checkups, we'll continue to have these health problems and challenges and disease burden. So there's human resource challenge. Doctors are no longer there, nurses are no longer there, pharmacists are traveling. So even when you go for health checkup in your facility, are you going to see them there? We must tell the government to provide more resources. Finally, move on. There are other issues. You can see people waiting to see a doctor. These are some facilities we can still see. I saw this in one place in Nigeria. Workers are challenged. Next slide. These are the population ratio. We need over 300,000 doctors, for instance, in Nigeria to be able to meet up with the needs of Nigerian population. Where are we going to get 300,000? And more are going to UK, US, Canada. Next. I'm running up now, please. So this was when I told them that Nigeria was losing over $1 billion to medical tourism. And the government kept a deaf ear. Move on. Move on. Buhari kept going. Move on. And I said, Buhari, why are you going on a medical trip? I said, UK, tell Buhari to come back to Nigeria. It was on the website of the BBC. Move on. I'm running up. Don't worry. So there are recommendations. Go on. Go on, go on, go on. So we need to create awareness for it, the implications, and all of that, the benefits. Move on. So government has its own responsibility, but we also as citizens must call government to account. We need to do medical checkup in Nigeria. That was why I told Tambuwa when I was Speaker of the House of Representatives that I'm making you the face of healthy living in Nigeria so that I can pass legislation to give Nigerians access to routine medical checkups. We have it barely written in the National Health Insurance Scheme, but how functional it is. Elsewhere, outside this country, you are entitled to health checkups at periodic intervals. I'm running up, don't worry. Move on, move on. I told Goodluck Jonathan, this is one of the things I told him to do when he was president of Nigeria. Move on. And like I told you, I told Tambuwa, tell your people not to go to France and UK anymore. Do your health checks in Nigeria here. And he said, he will do. This was when I started the medical outreach, first time in Nigeria, 1st September 2012, that has seen over 200,000 Nigerians attending to their healthcare needs free of charge. Move on. Move on. So we must also do research. Move on, move on. Let me just go to the last slide. So we need collaboration with... Now, but is health checkup necessary? These are the questions. It's critical. I just say it's necessary. But must it be annual? It must not be annual. Because the evidence suggests that depending on age, sex, and the risk factor, that will determine the periodicity. Does it cause longevity? I reserve this for the last so that I don't make you go into a bottomless pit of disillusionment. Scientific evidence suggests that it does not decrease mortality, but it helps you to live in a state of well-being, to manage the risk factors and all of that. In conclusion, I said that while there may be no concrete scientific evidence supporting the fact that routine medical checkup aids longevity and reduces the incidence of cardiovascular events, its numerous other benefits makes it imperative for accelerated efforts to be made to promote the concept of routine medical checkup amongst members of the public, including the leaders and the followers. Recognizing that only fit and healthy leaders can effectively lead and govern, leaders operating in different spheres, including religious leaders, should imbibe healthy lifestyle practices and endeavor to create time to have regular medical checkups. Move on. I leave you with the words of Albert Hastings when he said, and I quote, "The world we have created is a product of our thinking. It cannot be changed without changing our thinking." In my own words, I say and I quote, let's change our health-seeking behavior. What is wrong with that? Let's change our health-seeking behavior and adopt a lifestyle practice that promotes our health and well-being. I thank you. I thank you for this audience. Thank you for this opportunity. May we live healthily. and live in a state of well-being so that we can produce more for the Nigerian economy in spite of the deprivations by the Nigerian state.